Hi there. This webinar is about the Boston University MS in Nutrition and Dietetic Internship Program. My name is Mary Jane Staniak. I'm a senior lecturer here at Boston University and also the Dietetic Internship Director. Thank you for your interest in this program. To get things started, I wanted to give you a little bit of information about Boston University. We are a large urban research university made up of 17 colleges. We're located right on the Charles River in the historic city of Boston. Boston is home to 35 universities and colleges, making it one of America's best college towns. We also have countless medical centers and hospitals, world-renowned institutions, making Boston also a medical mecca and a great city to be a grad student, as well as learning and training to be a registered dietitian. We blend the college campus experience also with the city integrated experience. So, of those 17 colleges, our program is in the Sargent College of Health and Rehabilitation Sciences. We are made up of 4 different departments. So, we have students who are training to be occupational therapists, physical therapists, speech, language, and hearing scientists, and our nutrition programs are in the health sciences department. At the graduate level, we have 3 different programs in nutrition. We have a 2-semester MS in nutrition program. We have an MS in nutrition with a dietetic internship, or the MSDI program. And we have a 3-year program, the didactic program in dietetics, or DPD, combined with the MSDI program. So what I'm going to focus on in this webinar is the MSDI program. So what makes our programs unique? Well, we're an in-person program. We are STEM eligible. We offer a cross-college interprofessional education program. That is an opportunity over the course of the program to have a module-based experience where our nutrition students, our future registered dietitians, learn with, from, and by future occupational therapists, physical therapists, and speech, language, and hearing sciences. And we really believe that the future of healthcare is interprofessional. And so we invest in that for you while you're at Sargent College. Also, we have a state-of-the-art simulation center. Talk a little bit more about that in a minute. We have the opportunity for you to collaborate with faculty. I'm going to talk about our coveted practicum course, opportunities to engage in research. All of our preceptors and rotations are arranged by us, so you're not responsible for doing any of that legwork on your own. We have an optional summer study abroad course in Italy where students are able to earn graduate elective credits. We have a 100% pass rate on the registration exam, and this is very important. You're going to put a lot of time and effort into your program. You want to make sure when you've completed the program that you're going to pass the exam. And so we have a long-standing 100% pass rate on the registration exam, and that is based on the pass rate within 1 year of completing the program. We also have an approach that is really based on 2 steps, and I'll talk a little bit more about that as well. So who's an ideal candidate? That's a common question that I receive. Well, in order to be eligible to apply to this program, you must either have already completed or be in the process of completing a didactic program in dietetics, or a DPD program, or the international equivalent referred to as the FDE. That's the Foreign Dietitian Education Program. We're looking for students who are well-rounded, not only those of you who have a strong academic foundation that really prepares you for the rigor of a graduate degree from Boston University, but also those of you who have the interpersonal skills to work with a wide range of students, clients, patients, and healthcare providers. We are hoping to have students who value the diverse experiences that are offered through the program, as well as demonstrated qualities in critical thinking, leadership, adaptability, self-direction, and conceptual ability. We do not have any specific course-by-course prerequisites for this MSDI program, but the prerequisites include a bachelor's degree, a minimum GPA of 3.0, and that very important DPD or FDE verification statement from an accredited program. So the opportunity for our MSDI, for those of you who meet those criteria, you are able to apply. You complete one application. If you're admitted into the program, you are guaranteed a DI placement once you have successfully completed your coursework. We also offer a clinical concentration. So I mentioned the two-step approach. So in the first step, you're really going to be focused on your graduate coursework at Boston University. And this is an important time for you to build your foundation, to really expand on all of what you learned in your dietetics coursework prior to this. And it's going to set you up well for success once you get into your dietetic internship. So we want to make sure that our students have completed their graduate counseling course, their advanced clinical course, also the coursework in metabolic regulation and nutritional epidemiology. These are all important for you to build the confidence that you need so that when you're in your dietetic internship, you're able to get the most out of that clinical training, and you have that confidence to be able to engage not only with patients, but also with the other members of the healthcare team. Some of the highlights of the academic component of the program include coursework that will deepen your foundation in human nutrition science as well as nutrition metabolism. We offer a clinical concentration, which we believe is really the best way to prepare you to go in any direction that you'd like once you leave Boston University. Whether you want to go into media and communications or sports nutrition or private practice or a whole host of other opportunities, we really feel like having a strong clinical foundation is going to set you up for success and allow you to be a leader in whatever area of the profession you are interested in. We offer research experiences to inform evidence-based practice. We also give ample opportunities to sharpen your communication skills, hone your counseling skills, really develop strong MNT and nutrition assessment skills, and we do that in our simulation lab. We offer this semester-long practicum, which is always a favorite. And all of these things combine really get you ready for your supervised practice or your dietetic internship. The academic courses span 2 semesters, so they're 2 full-time semesters. We have 3 popular graduate electives right within the nutrition program that are taught by our nutrition professors. I already mentioned the summer study abroad course in Italy. We also have a popular eating disorders prevention and treatment course, as well as a course for nutrition for sports and performance. You're not required to take one of your electives in the programs of nutrition. If you so choose, you can take your elective in really any course, any college, I should say, at Boston University, so long as you meet the prerequisites for it and it's not closed to majors. So I mentioned that clinical concentration, really offering a safe space before you go into your dietetic internship to practice some of the really important skills. There's a few pictures here that show Professor O'Brien. She has the red scrubs on there. In these pictures, she is training the student on how to complete a nutrition-focused physical exam. So this is the opportunity for you to practice. We hire actors and actresses for our students to work on real humans and develop those skills so that once you get into your clinical rotations, you've done this before, you've practiced this before, with the supervision and the feedback that is going to really prepare you in a meaningful way. I'm going to take a minute now and pause and show you a brief video tour of our simulation center at Sargent College.
Welcome to BU Sargent College Center for Simulation. Today we're going to take a look at the Sim Center through the lens of the nutrition program. The first room that we enter here is the debriefing room, which is where we can talk about things that happened in today's case. We've also demonstrated some of the equipment that we had, things like edema pads, manual and automatic blood pressure cuffs, and glucometers available for testing patients' blood sugars. So now we can move from the debriefing area into the hospital area, where we have 2 simulated hospital patient rooms. In these rooms, we can use a series of standardized patients, or today, we see our simulated patient is our mannequin Juno. And Juno has just had a feeding tube placed using our CoreTrack machine. We can also monitor Juno's vitals while we're here in simulation, see what kind of IV fluids that they might be on. Each room is equipped with a hand washing station to get prepared for donning and doffing PPE. And we can see that we have a mirror here. This is a special 2-way mirror that allows faculty to evaluate students without being present in the room. And we can watch everything that is going on as well as record it in our specialized system here in the control room. We then move from the control room into the second patient hospital room. You can see we still have many of the same equipment as well as additional. And for today, we also have set up our bassinet with our baby mannequin, in which we can get some anthropometrics of our baby mannequin. We'd love for you to see what we enjoy here in the Sim Center from the nutrition program.
Hopefully that gives you a sense of that space. If you're able to come to campus, you'll be able to see that in person, and we're always happy to meet with students. We have a variety of on-campus events. Usually once a month, I hold an information session right here at Sargent College. But if those dates don't work, definitely reach out to me, and we'll try to accommodate your timeline of when you might be able to visit us. I mentioned one of the favorite components of our program, the practicum. In the practicum course, students have the opportunity to really apply some of what they've been learning in the classroom in a hands-on setting. So over the course of a semester, students spend a minimum of 150 hours working with a registered dietitian. That's about 11 hours per week on average. And students are able to explore an area of interest to them. It might be a possible career choice. It might be an area of the field that you haven't had any experience in that you'd like to get a taste for. It might be pursuing an area of the field that you really love and you can't get enough of. So a lot of opportunities here. We have over 50 affiliate sites where we have students, and the range is really throughout the entire scope of the profession, including clinical sites, community settings, culinary nutrition opportunities, eating disorders, food service management, opportunities in industry, media and communications, nutrition research, private practice with a registered dietitian, research, nutrition research, schools, and sports nutrition. So a lot of choices, so much so that students usually have a hard time deciding where they'd like to spend their practicum. One of our practicum sites is our Sergeant Choice Nutrition Center. This is a one-of-a-kind resource that we have, that we're so fortunate to have at Boston University. This team of 9 dietitians provides expert counseling and medical nutrition therapy for a variety of patients. So these patients and clients include students, of course, but also faculty, staff, and the general public. I mentioned that Boston is home to many universities and colleges, and many of those colleges don't have their own nutrition program. And so students come from other universities and colleges to get their nutrition care. We also have a Terrier fueling program. So Terrier is our mascot. And if you're interested in working with our student athletes, there's opportunities there. And whether it's a volunteer experience, a directed self-study, a practicum, or DI rotations, there are a lot of opportunities to engage with this amazing team of dietitians. So once you've completed step 1 of the program, then you move into the second step, and that is the full-time supervised practice component of the program. We refer to that as the dietetic internship phase of the program. So I run this program with my colleague, Professor O'Brien, and the program structure is listed on this page overall in year 1. In the fall, you'll come to BU. In the spring, you'll continue at BU. And then in the summer, you'll be ready to start your dietetic internship. In year 2, so starting that next fall, you will do the fall semester at your DI as well. And then you'll be ready for graduation in January, about 16 or 17 months later. Once you're in the full-time supervised practice portion of the program, or the dietetic internship, you'll spend 29 full-time weeks in your training. So the majority of your training, 21 of those 29 weeks, will be in an acute care setting, focusing on inpatient, outpatient, and staff relief rotations. You'll have 4 weeks in food service management, 1 week in community nutrition, 2 weeks in pediatric nutrition, that could be in a clinical setting or a community setting, and then a 1-week elective where you're able to pursue an area of interest to you. In addition to those 29 weeks, we have a 1-week vacation that's separate from your DI training. Please refer to our website for all the up-to-date numbers with regards to tuition and fees and other benefits. So our DI placements include a variety of sites. Some are large urban tertiary care hospitals. We also have mid-sized teaching hospitals, as well as smaller community hospitals. And we at BU have a variety of students come to us looking for a variety of different things. Some plan to go the clinical route, some plan to go in other directions. And so we've got a little bit of something for everybody. In addition to all of our primary inpatient acute care hospital sites, we have many other possible sites that might be part of your rotation schedule, including opportunities right here at Boston University, either in our Sergeant Choice Nutrition Center, our BU dining facilities, or our BU athletic programs. We have partnerships with other athletic programs. We have partnerships with pediatric training facilities, local schools, a veterans facility, many private practice dietitians. Our alums, we rely on heavily for that. We have affiliations with a handful of eating disorder centers, dialysis centers, and a couple of pro teams, including the Boston Red Sox and the Green Bay Packers. Depending on your site placement, you may need a car to get there. You wouldn't need a car during the academic portion of the program, but all students are responsible for transportation to and from their internship sites during that phase. So the application timeline. We do have a January entry for the MSDI program. However, it's currently full. If you want to check back on that to see if there's any movement there, I'm happy to give updates there. For those of you who are looking to start in September of 2026, our application deadline is October 8th. If you are a BU undergrad student, you can apply pre-select, and your application deadline is October 1st. In recent years, we have filled our classes in the fall season, but if space remains this year, we will reopen the application. That said, we have not had space in the BU MSDI program for several years now after the fall cycle. So if you are interested in our program, I strongly encourage you to apply by October 8th. Other key dates in the DICAS portal. All programs that you apply to are required to give you a decision, whether that be acceptance, a wait list, or a decision that they don't think you're the best choice for that or the best fit for that program. So we all must notify you by November 1st. You will have 2 weeks to make your decision. Decisions nationwide by all programs for applicants is November 15th. If you have any questions about that, reach out. I'm happy to give more details there. All of our grad students have the opportunity to partake in paid assistantships. So we have graduate assistantship positions. Those are fairly competitive, and you are all considered for these at the time that you apply. There's not an additional application for those. We have many teaching assistantships. We have paid ambassador assistantships, and we also have social media assistantships. Those are all paid positions. Outside of the programs in nutrition, there are additional opportunities, including the fitness and recreation department. They have graduate assistantships, as well as our housing office. They have resident assistantships where you can earn free housing, a meal plan, and a stipend. So these are all great opportunities for those of you who might be interested. For questions about the application itself, whether it be transcripts or if any of your letter writers are having trouble writing your letters of recommendation or uploading those, please reach out to our Senior Director of Graduate Enrollment. That is Alessandra Monroe. Her contact information is here. If you have questions or want more information about our anything related to finances, I encourage you to reach out to our Associate Director of Graduate Financial Aid at Sargent College, and this is Jasmine Samuel. She is an expert in all things related to this. For the 25-26 application season, we are guaranteeing merit scholarship for all admitted students, and that is applied to the MS tuition when you're in the full-time coursework. During the entire program, our students are eligible to apply for federal loans, if that is of interest to you, as well as the opportunity to apply for the insurance. So I want to thank you for your interest in this program. I'd encourage you to participate in one of our live events. So check out our events page. You can grab the QR code here. Like I mentioned, I typically have one in-person on-campus event per month. And usually I host a live virtual event as well, usually one a month. So I hope that this information is helpful, and feel free to reach out to me. You can email us, and best of luck to all of you. Thank you.